Please welcome our next panel, Technology and AI in Skilled Nursing, The Pathway to the Future, featuring Sue Coppola, James Yersh, Chris Eamiguel, and moderated by Tim Fields.
Hey guys, we can hear good. I'm Tim Fields, CEO and co-founder of Ignite Medical Resorts. We are a skilled nursing operator, mostly in the central time zone, so Illinois, Indiana, Kansas, Missouri, Oklahoma, and Texas. We have 22, soon to be 23 facilities that focus heavily on short-term rehab. And we've been big believers in technology, which is what we're going to talk about today. So I figured we got to start a technology panel with some tech. So I want to bring up Ignite's Chief Therapy Officer, Matt Thengel. Talk a little bit about one technology.
Thanks, Tim. Good morning, everyone. I'm Matt Thengel, Chief Therapy Officer with Ignite, as Tim mentioned. We just rolled out in every single one of our facilities this device right here. It is an immersive virtual reality. James, can you just hang on to this for me? Sure thing. So what we're able to do is we are able to put this on our patients, and then the clinician actually has a tablet that they can see what the patient is actually viewing within the headset, and then we can modify that task based on what we see. We can make it easier, we can make it harder. So it's really been nice for those patients that really would prefer to be isolated and stay within their room and maybe not come into a crowded gym. So this can be taken all over the facility, bedside, in the gym. Actually, it can be outdoors as well. It's got a mobile hotspot, so you don't have to connect to the building's Wi-Fi. But I want to share a video with all of you so you guys can get a chance to see how this works.
What do you think?
I think it's very good.
Very good, yep.
You know, it means your mind carry that your hand can.
Yes, it can. Yes, exactly.
Thank you. So, you know, some of the advantages that we've seen, we've been able to really work with those lower level patients that really don't have the ability to move their extremities, really getting the cognitive component involved as well. For us, this has been a really big game changer on the marketing side. We've taken this and done presentations at the hospitals with case management groups, and they've just been really excited to see that there's just other options that are out there in terms of rehab. So yeah, just wanted to give you guys a little taste of the VR device. Thank you guys.
Thanks, Matt. So we're going to set the stage here with our great panel, Chris, Sue, and James here. They're going to talk about some great ways. I think with technology in our industry, we've always been kind of laggard behind a lot of other care settings, as you guys know. Physician groups, hospitals, even other care settings, sometimes like acute rehab, have been big believers in technology and have been able to, I think, one, afford, and two, probably be ahead of the game from having vendors that are in their space to be able to utilize technology. So we've always kind of been at the bottom of the totem pole, and so I think it's great timing as we've come out of the pandemic and come into some new worlds of how do we use technology to make things better. And that can be in different areas. We're going to talk a lot about today. You just heard about therapy was one area. We're going to talk about clinical. We're going to talk about back office and business intelligence. We're going to talk about AI, of course, the big buzzword of AI. We're going to talk a little about operations and how you can use technology in many different areas to make things better. So we're gonna start here with Chris. So Chris, you want to introduce yourself a little bit and talk a little bit about creative?
Absolutely. I just want to start off by saying I'm pumped to be here. Anyone that knows me knows that this is what I'm all about, technology, data, analytics. So Tim, thank you for having me on this panel. So I work for Creative Solutions in Healthcare. We are an operator out of Texas. We have, I think, about 170 buildings. The number changes constantly. So I think we're the largest singular provider in one specific state. So we don't have any other buildings outside of Texas. But to get back on the track of the panel, our exposure in technology started about 10 years ago. And as much as I'd like to tell you we were forward thinking and this is why we invested kind of early on in the nursing home industry, the reality of it is when I started with this company 11 years ago, it was my job to continuously make reports and send them out to operations. And I got tired of, creating our per patient day reports and census reports on Christmas Eve and Christmas Day. So I invested, my personal time into understanding how data worked and how to automate analytics. I don't have a hobby. Anyone that's played golf with me knows I'm not very good at golf. So, we invested a lot of time into understanding how to automate operational analytics. It was taken a step further when, on the finance side, one of my first roles at Creative was a financial analyst. And we were doing financial reviews. We were using P&Ls that were 45 days in arrears. They were summed up to the general ledger code. And, at the end of the day, it was, well, your census isn't high enough. Your revenue rates could be higher. Your staffing is more than what we expected it to be. But it didn't have any substance as to, what can you do to make a change? So here at the corporate management, level, we're not creating a dollar. We're not saving a dollar. It's all about the boots on the grounds and the operations. So it was on us to figure out how can we supply the information and the data to the facilities to further educate them so that they can make an outcome, an impact to the financial bottom line. And so we figured out how to answer the what, which is, what is seemingly the issue. And then we realized we have to answer the why. So we took data analytics to a further step, and we started getting down to more specificity, started curating data points that were less summarized so that we can get down to the nitty-gritty. I'll give you guys a quick example. One time, I was at a conference and I heard Billy Beane speak, which that's Moneyball for those of you guys that are not big baseball fans. And he was giving a keynote speaker talking about, how they got an edge that ultimately made one of the biggest underdog stories in the World Series. And what they were doing is they were curating metrics that were not being curated by other baseball teams. And so we kind of took that same principle to the nursing home industry. And so one of the big things that we had was overtime and staffing. Now, staffing's a little bit different post-COVID than what it was back then. But we had a suspicion that we, were having time taken away from us from meal breaks. So we created a proprietary metric called the meal break KPI that basically was, a way for us to track and manage how well buildings are doing from a meal break perspective. It wasn't something that was being done in the industry, but ultimately that ended up saving us about $3 million. And then, the size and scale of the business now, that would translate to about $10 million. So it's been a big success story. Obviously, that's just one example. Think about, 10 years in the making of developing, business intelligence, and that's where we're at right now.
Great, so that's on the business intelligence side, which is great on your finance background, but what else is Creative doing outside the realm of finance in terms of other tech initiatives, maybe on clinical or remote patient monitoring?
Yeah, that's a great question. And, we're in an interesting time in the industry where, value-based care is arising. So even from a clinical perspective, a CFO like me is very interested into the quality of the product that we're producing. Because not only does it, affect our residents that we're taking care of, but it also affects our bottom line now. Especially in Texas, we have UPL programs where, at the end of the day, the theme of healthcare is moving away from fee-for-service more towards, pay for performance. That's where we're headed. So it's very important for us to invest into technology solutions that allow a better clinical outcome. I'll give you guys an example of one of the investments that we've made over the last couple years. So we partnered with a company called Tapestry. I know they're a big sponsor here. They have remote patient monitoring. So basically, we have vitals that are being measured by our residents on a constant basis that are being reviewed by nurse practitioners. And what it allows us to do is curate information and allow us to be proactive in our approach for clinical services. And ultimately, back to the finance perspective, that decreases our rehospitalizations, which ultimately, increases things like our Medicare rate. We have an I-SNP, so, we get upside on there as long as we're, keeping them, in the nursing home. So these remote patient monitoring allows us to be proactive, and whenever we know that there's going to be an issue with a resident, we can deploy our nursing staff, and they're kind of, at the forefront of it.
So one of the things people always talk about with technology is how much does it cost. So how as a CFO do you look at ROI and ROI analysis for technology solutions?
Yeah, ROI is a funny thing. So, as we've been developing business intelligence, we've also kind of created a company called Data IQ, which services now 1,200 different facilities across the country. And being on that side, on the sales and development and trying to sell this product of business intelligence to other operators, the number one question that I always hated was, what is the ROI? The reality of it is every single operator is different. What is important to them is different. What they are succeeding at and what they are not succeeding at is completely different across the board. And so for me to try to give that answer to somebody is what could my return on investment be in investing in business intelligence? Well, I think really the reality of it is what is the opportunity lost by not investing in the technology? I can't give you a percentage or a dollar amount as to what it is, but I'll give you an example of another recent technology investment that we did. So as everyone in this room is aware, there's things that are being talked about related to staffing. And in addition to that, with our Texas UPL program, there's now a reimbursement tied to staffing. And so historically, we were doing the same paper, pencil scheduling. Every single facility was kind of on its own as far as they had their scheduling. We were managing the hours to make sure they were within our budget hour per patient day. But now that we have to essentially plan and make sure that we have the appropriate staff, we had to invest into a technology to help us manage staffing. So one of those companies is Cover, and they're here. And then another little in-house solution that we've been working with. But the opportunity for us to not hit those metrics, and if the minimum staffing becomes a thing, the repercussions of us not being prepared to be proactive of that is a lot. So unfortunately, I don't have a percentage or a number for you, but it's more about the opportunity lost by not investing in technology.
Great. So a perspective from an operator with Chris. We'll move to Sue. Sue, do you introduce yourself, your background, and your role at Sabra?
Hi, good morning or afternoon. So I'm Sue Coppola. I'm a registered nurse. I started out in the ICU and ER and moved into hospital level executive management back in the day. And then on to PricewaterhouseCoopers, where I worked in their global healthcare consulting practice. And then there came a day where I just decided that traveling, every day, 7 days a week at PwC became a little too much. And I switched into post-acute care, and I've been in this sector about 22 years. In the C-suite, chief clinical officer, chief compliance officer, interim acting CEO positions, et cetera. So I've seen a lot in my career. And when I went to retire 2 years ago, Rick Matros reached out to me and said, Sue, I want you to begin to evaluate how technology can assist our partners in improving team member satisfaction, resident satisfaction, and clinical outcomes, and operational outcomes. And working at the intersection of how the environmental factors can influence social outcomes. And I was like, wow, Rick, that sounds exciting. And for those of you who don't know who Sabra is, they're a healthcare REIT. They have just over 400 properties. They have about 60 partners, 62 partners that we work with. And they are operator-led REIT and with a vast experience. So I pivot to Sabra. I love it. And I am evaluating technology. And why would Sabra have that is because we, to what Chris was saying, we are behind in post-acute care. How many vital signs are still being taken with a blood pressure cuff? I won't ask for a show of hands because I'm sure there'll still be many. How many are using a Dynamap blood pressure automated, but it doesn't connect to the EHR? And these are just the simple things, right, that impact both accuracy of the vital signs in addition to team member time, right, nursing time, CNA time. And those two factors are significant. When we talk about return on investment, it's difficult sometimes with technology, but it is the investment. I'll never forget on EHR, and we were evaluating EHRs, and the board said to me, Sue, where's the return on investment? Why are you expecting me to invest over $2 million in an electronic health record? And I looked at them and I said, you know what, no offense. You have financial investments that you've made. You have business intelligence that tells you about how we're doing financially, but I have nothing. You know, running 376 buildings across 38 states, and I'm like blind. I said, I need data, I need systems, I need processes. If you want to have better operational results, you will begin to look at the clinical and the intersection of clinical quality and operations. And I got my investment, and I was able to, within 2 years, show the significant return on investment in both quality outcomes, staffing satisfaction, team members, as well as the financials. And I continued my career in that way and continue to look at technology in a way that, yes, it's an investment, it's a big investment. But when we begin looking at remote patient monitoring, we just did a great initial implementation with Ignite on Falls with a program called CamiCare, and we assisted them in developing their software so that we took Falls from 28% down to 8%. We took return to hospitals down by about 30%, ER utilization, and the team member satisfaction. I always ask team members when we're doing technical implementations, what would you do 6 months after, because it takes about 6 months to get everything embedded in the operations. What would you do if I took the technology away? And when they say, I'd kill you, I'm happy, right? So that's where we want to get our team members. But the challenge that's happening right now is, are we including our team members when we're doing implementations of technology? The biggest challenge I'm seeing is not the technology isn't working or that with some tweaks it won't work. It's the team member involvement in embedding it into the operational systems, daily, weekly, monthly, quarterly, is being missed. It's kind of like RPM's coming, we've got the low radar technology, and we're working with a third-party provider such as Tapestry. We do a lot of work in this area too, but we're not necessarily embedding it into the systems and processes, and the team members aren't bought in. I'm a nurse, I feel like I can say this, nurses are hard. Like we all think we can do everything, right? And technology is a solution. Very opposed to AI. I'm sure you've been doing a lot of reading on this. However, if you bring the nurse along and you educate the nurses and the CNAs and the team member as to what's in it for them, they will come along, and technology, we can advance it. There's no one great solution out there right now, but by all of us investing and beginning to see that we have to embrace it, these technologies will become better and better, and they'll evolve to give more back to our sector. And it's important. We've got a nursing shortage, over 4 million nurses short in the next upcoming years. We're going to have more residents than we are going to have caregivers for the first time in the United States. And this means we've got to find ways to engage and help to streamline those jobs, because it's not like we're replacing people with technology. we are enhancing our operations and we're enhancing our outcomes. So that's why Sabra has decided to invest in me and in our partners, and it's been really, really well received and loving every day.
Well, for any of the lenders or landlords in the room, why do you think it's important to invest or help the operators invest and analyze technology?
It's really important because we need to attract more people to post-acute care, right? And if you're in other sectors of healthcare, technology is being used. I mean, just as simple as why when you have a Bluetooth-enabled vital sign machine that I can take the vital sign and send it right to the electronic health record. And do you know how many people I say, oh, the cost of that is too much? You cannot afford not to have that, right? If we improve our vital signs, did you know the average rate of vital sign accuracy in the United States is about 62%? You move to one of these machines, you're at 100%. You want to impact your return to hospitals? You want to impact some of these quality measures? What better investment than to invest in vital sign accuracy? You're saving about, depending on the size of the building, anywhere from 100 to 300 hours a month in team member time transcribing vital signs from what I used to call a scut sheet, into the health record. So how can you not be investing in this? And honestly, before I die, I hope everyone's going to have these machines in their buildings because it's just should be a given. It's important.
Sounds good. Well, you can't talk technology without talking about point-click care. And we've got James here to help us with that. So James, you'll tell a little bit about your role at point-click care and maybe a little bit how point-click care views technology and AI?
Yeah, sure thing. And good morning, everybody. Happy to be here. So my role at point-click care, I actually have two. I'm the company's chief revenue officer, which means that you would deal with me in terms of anything from sales through to post-implementation, optimization, and actually using the software. But I'm also the company's chief financial officer, so things like ROI and trying to get that type of speak into what our sales teams do, how our customers or how our teams show up for customers is still part of what we do there. Obviously, we spend a ton of money, over $100 million in R&D, trying to do all the things that you heard Sue and Chris and Tim talk about. AI, biggest buzzword that's out there. Ultimately as a technology company, and I've been around tech for all of my adult life, I like to say. This is my first one into healthcare, but obviously as a technology vendor, we're there to help make you successful in whatever you define success being. Now, obviously with things like value-based care, everything that needs to be successful is different by customer, by element of what you're doing, and of course the patients that you see. So our responsibility, we have many in my view, and specifically focusing on AI. Number one is, making sure that your data is secure, and that, ultimately in terms of the regulations you need to comply with, how you're going to use it for AI, it's an evolving world, and I think the rules are going to continue to evolve and change, and we're going to be there to help you figure it out. I don't think anybody's got it figured out. Everybody says they're doing AI, but again, I'll give you some examples of what we do. But in the end, what you heard from Sue and what you heard from Chris is there's multiple ways for you to just get more data on what's going on. And especially when it comes to AI, there's three ways that I think about it, and you probably have heard of at least the first two. There's predictive AI, trying to figure out that something is going to happen based on the data that you see changes on. We definitely have algorithms built into our software that looks at the baseline from your patients, multiple times a day and flags those patients to you or to your nurses to be able to focus their efforts. It's one of those things that either you're going to, surface insights or tell them go see this person rather than somebody being reactive and trying to find that proverbial needle in a haystack almost. So just using the baseline, using all of this data, and then flagging things for people is definitely something where, that will drive success. Ultimately, it's one of these things where, there's not enough time in the day to go through and comb through files and, electronic records. to find what's going to go bump in the night. So that, in terms of our responsibility as a vendor, we take that very seriously. And again, it'll help with the staffing shortage, it'll help focus, and it'll drive outcomes in terms of improvement. It'll, keep your medical loss ratios down and probably allow you to accept more complicated patients to be able to drive your RAF scores up and actually drive more revenue for you. So predictive, I don't think it'll ever replace a nurse practitioner, the judgment that happens, or a doc coming in from there, but it can actually suggest. And so I moved from predictive AI to suggestive AI in terms of, okay, go in and look. And then once you're in there looking, it can actually suggest, for this type of ailment or this type of acuity, here are the drugs that you may consider, because we saw it work in this case. And so it can help the practitioner do what they want to do and hopefully increase the precision and the outcome of what happens there. Again, not as a replacement to be able to, replace the person that's going to be at the bedside, but ultimately there is a way to do this that, suggestions, because we see a number of patients a day, we see all these cases across our customer base, and therefore we should be able to highlight and help as opposed to replace. Think about it that way. The last one that I'll talk about is the concept of generative AI. And one of the things that we think we can help with is when a nurse is there, they don't like to document. I'm guessing, Sue, you can probably smile or disagree with that.
Absolutely agree.
But
of course, not me.
Not you. But in the end, really we want to give people that are delivering care more time at the bedside. And so imagine a generative AI model that can take nurses' shorthands or codes that they're just entering and actually create the full note of what should go into somebody's file so that it's compliant, everybody can understand it, it's using the right language, because of course, we can see what the notes would look like. Obviously, you have surveyors coming into your building. They want to see things a certain way. So you can actually just augment what somebody is doing, take administrivia away from them, and actually give them more time to be delivering care at the bedside. And so all of this, just a few spitball ideas, and we're doing a lot of these things now, but I think these cases are just going to continue to evolve. And again, it all depends on what you're delivering, how much data you're capturing. But I think it's prudent to say that just the amount of data that's going to be there about a patient just needs some help to be able to surface those insights. And then we can use that to give people more time, giving staffing shortages and everything, to be able to deliver care at the bedside.
So I know you guys try to do a lot within PCC, but you guys can't do necessarily everything. So how do you view your integration market, your different vendors that plug into the medical record? How are you guys partnering with them, and what has become unique and innovative about that?
Well, we actually have, it's a big part of our ecosystem in the end, Tim. We actually have a marketplace where we allowed vendors to either write to us, take data from us, or do it both ways. And in the end, these are just solutions where we're not going to build it. It's not necessarily core to what we do, but we know that you all have a need, whether that's additional insights, whether it's additional solutions. So it's a big part of our ecosystem to be able to deliver value to how you want to run your business. It doesn't have to all be with us, and there are some areas where we're not going to pretend to be the experts, or we're not going to build technology with that. But you all have a need, your nurses, your practitioners have a need, and therefore we need to be partnering them with responsibly, as I say. They need to hold up to the values of security and everything else that we need to be for you. They need to be an extension of us. They need to be able to partner with us. But I think I said we're up to 380, 350, somewhere around those numbers. And there's always people that are applying to be part of this, and we'll embrace that. We'll continue to do that.
I'll just add on that. It's really important, right? I mean, from an interoperability, we hear that word a lot. The one thing that causes, whether it's nurses, operators, however you want to use the terminology, the greatest fatigue with technology is having to look at multiple different dashboards, getting multiple different alarms, being inundated with data from a variety of different places that isn't connecting. And this is going to be a key part to the success of technology in our sector.
I think also just, there's also a lot of stuff we've talked about clinically, but there's also stuff that goes into the reimbursement side too.
right.
You speak a little on that too, and maybe some of the stuff you guys are doing on reimbursement or some of the vendors you're working with?
Well, just in terms of reimbursement, again, value-based care, either improving outcomes, keeping your costs down. We're just trying to give people more tools and insights from that. Once people are going through documenting, we have tools now that'll help before you submit MDS figure out, well, did you actually have the right code? Did you check the patient for this? And maybe you can actually deliver a different type of service that will bill at a higher rate, et cetera. So it's about quality, it's about completeness. But again, if you're actually providing care, you should be compensated for it. And it's also about, making sure that you're getting, your due share of the reimbursement and what's happening there. And so all putting these financial insights together with the clinical, allows us to be able to do that. We do have technology partners, back to your question, Tim, that also can do that and augment it for specific cases where, if it's behavioral or something like that, they are specialists there and we can help with all of it. But again, it's all about giving you the tools to maximize revenue, to be able to give the care and, be successful in the value-based care world, as Chris had said.
And I just wanted to add to that, right now we're seeing a transition where Medicare Advantage plans are becoming more prevalent in this space, right? Traditional Medicare is, slowly being replaced with these Medicare Advantage plans. And, obviously those companies are gonna want to do what's best for them. But I will tell you that if you don't have a foothold on your data points, your metrics, your quality, you're going to be held hostage in those contracting negotiations. So, outside of providing the quality care, like what James was saying, having the information, patting yourself on the back, advocating to get the best possible contracts, and then ACO partnerships as well. So if you want to be, attached to an ACO and get referrals, you're going to need to bring to them your information, and you have a unique opportunity to where you can cherry pick the things that your company does well, and you can hyper focus on those instead of just hear from the other side of the table of the things that you could be doing better, and then that's why you're not getting the outcome from them that you want. So that's a crucial part that I think kind of goes hand in hand with that on the reimbursement side. It's just being an owner of your own data.
Good point. So final question, each one of you to answer is, where do you see the skilled nursing industry in terms of technology over the next 3 to 5 years? James, you want to start?
Sure. Well, I think Sue summarized it well in terms of all the problems that we're going to have. I truly view it as an enabler and almost assistance to be able to be successful to the industry, to the operators, to the nurses, the practitioners, to all the groups. Everybody's going to have their own view of what success is, like we've all been talking about. And I think technology is just there to solve problems. That's what we as a vendor do. That's what we need to do for you all as you go through this journey, because it's not going to get easier. I think there's just going to be more data. We need to do it responsibly, as I've been talking about as well. But in the end, it's our responsibility to give you the tools to be successful and surface those insights that I mentioned.
Sue?
Yeah, I would agree. I think, whether it's looking at staffing, whether it's looking at reimbursement, whether it's looking at clinical, operational, technology is a part of our future. It isn't going away, and we really need to find a way to embrace it and integrate it and leverage it to solve our challenges. And even though, everyone has a lot of the same challenges, every organization is unique. And there will be solutions for each of us in what we're trying to solve for in our organizations. So embrace it and help the teams, because that change management is the most critical part of success with technology.
Yeah, there's a great quote, technology is great when you use it.
Yes.
Yeah, exactly.
Chris?
So when I think about the next 3 to 5 years and how technology is going to help augment the industry, I sat in on the panel previous to this one over the capital markets, and there was a discussion that a lot of the money from the capital partners and banks are flowing to the what they describe as the A-list operators. the ones that have really figured out how to adopt technology, the ones that can scale to big sizes. Because the only way that those operators can scale is by adopting technology. You have all these different operations happening all over the country and the state, and the only way to continue to have a foothold and augment your own product is to continuously be investing in technology. So I think that there's going to be a transition to where these bigger operators are going to continue to be bigger because they have, elected to invest in technology solutions. I think you're going to see a lot of things that are going to be, married with value-based care. And I think that we're going to have, so the premise of AI, right, machine learning, I know that gets thrown around like a buzzword a lot, but the reality of it is, the whole premise of it is it's continuously learning and evolving. So you would expect that at the initial start of artificial intelligence, that's when it's going to be the dumbest. I think eventually we're going to have more and more data points curated, more and more MDSs that we're going to be analyzing, more and more clinical notes that are going to be evolved, and those AI models will eventually get to the point where they're pretty smart. Their efficacy rates are going to be pretty high. And I think that whenever we get to that point, we're going to have a lot more people adopting. But our stance is get into it early so that you fully understand it, so that you can maximize your advantage, right? And that's been a big testament to creative solutions success in our growth model, because we try to be at the forefront of those technology adoptions. But to Sue's point, one of the most difficult things, and I'd actually like to pose this question to you, you can have all this technology, but adoption is so key. You really get nowhere unless you have adoption. And like I mentioned before, the corporate management ivory tower, we're not, providing utility to the business. It has to start at the facility level. And so I would like to know, Sue, you have this exposure to all these different operators. What have you seen from an operator to advocate for adoption, and how have they been successful, knowing that there's probably some operators or landlords in here that are interested in, augmenting their tech stack?
So there's a couple different ways, right? I mean, certainly it's engagement of the team from the very beginning so they understand. It's building it into the daily, weekly, monthly, quarterly processes. I don't know any way simpler to say it than that. But there's also create your adoption indicators. Yeah. What reports are you going to receive that shows utilization, right? What do you expect for utilization? When do you expect it to be utilized? And then how do you look? Because then you're going to be able to say, oh, Sue on the third shift isn't using this at all. Let me go talk to her and ask her why. So it takes engagement from all levels, and it does take some metrics around adoption so that you can actually manage that implementation. And that's when we see the success, is when we're managing it in that way. And I'll also say, including physicians in clinical technology is critical, and getting them to be a part of utilizing that information to help the nurses and save the nurses time. And the nurses like that because they like working with physicians and they like that interaction. It helps develop their skill.
Yeah, that's great.
Great. Well, we've heard a lot about different technologies and different applications from different viewpoints. And I think the key here is as we continue to go over the next 3 to 5 years, we're going to have a lot of different vendors. We'll have a lot of different technology. As Chris mentioned, AI is going to continue to get smarter. We're going to have a lot of different things that we can do. And as an industry, we need to continue to push the boundaries on technology to help us deliver better resident care, better therapy, better business intelligence, and make us a more sophisticated industry. With that, we've got a couple of minutes left for some questions from the audience. Someone's got a mic? There you go. Ray? How did I know you were going to be the first question?
You should have known it would have been me.
Everybody's
Thanks
nervous
so much,
though,
guys.
right?
That was really, really good discussion. One of the greatest obstacles to adoption that you talked about really is the ability to pay for this stuff, right? As an operator, there are so many areas that are requiring investment and so many innovations that could be if only we could pay for it. Have you found creative ways of operators partnering with their finance people to get this stuff paid for? And what are maybe some examples of how to go about doing that?
So, I mean, I'll say at Sabra, we offer financing for technology and e-green initiatives. We also will, based on the operator and their commitment, we have, sponsored the piloting of the technology, the costs around that. But I would say, Ray, that one of the biggest challenges we all have is working with the payer sources, our insurance companies. We found some creative ways around utilizing RPM codes, RTM codes, so that the technology can actually get paid for underneath that coding with our physician partners, such as, Tapestry, and we're using technology like Natera and Xandarcardian and others under that model. So it takes some creativity, but we're working really hard, kind of like the group that was here before, right? Every situation's a nuance, so what can we do to get it paid for under that situation?
Yeah, and from my perspective, if there's anybody that we're leasing buildings from that want to, approach me about some financing options on technology, I'd love to entertain that conversation.
The only other thing I'd say, Ray, is we do see some partnerships between an acute setting and then the post-acute setting, where if the SNF does certain things, does certain assessments, effectively the acute partner is willing to help subsidize the cost of that. Because obviously they're getting what they need for their compliance, and the person is not going to come back and show up in the emergency department, and all of a sudden there's a readmission, which everybody loses in. And so the more standardized, and pushing the compliance down, once they're gone from the acute setting, we've actually seen some of our customers get subsidized by their partners where they're getting referrals from.
CMS has had some really interesting grants, as well as some state funding grants for technology. So, I'd suggest if you're interested, looking at within your state and within the feds on the grants that are available for different technology types as well.
And I'll kind of add to that. I think, it's situational too, right? So I'll give you an example, in our state of Texas. So like I had mentioned, we have an UPL program. One of the things that's been unique of that UPL program is you're incentivized to have telehealth services for RNs. The idea is that, you're striving to have a 24-hour coverage of having an RN all the time. And so the partners, the NSGO partners in that UPL program have, helped us fund those telehealth investments. So I think that, it's very opportunistic, and I think when there's a situation where both parties can benefit, that there'll be some folks that will come and start infusing some money into the operations.
A question here.
Thank you, guys. So it's great to see all the tech that you guys are working with now, and I actually wanted to maybe hear, Tim, your insight on this. I know you're the moderator, and the questions weren't posed to you, but as I know, and I'm sure most of us in this room know, that the Ignite Medical Resorts do an amazing job at a lot of the things that you guys are doing with technology, and for all you on the panel. But in regards to tech and AI, the question, I guess, for all of you, and Tim, I'd love to hear your insight as well. Do you think we're behind the 8 ball in regards to the industry? And if so, how are we going to address that moving forward? I know that obviously there's a lot of adjustments that need to happen, but I'm curious if, from all the advancements that we've made and from all of you and everyone in this room has worked on, were we behind the 8 ball, and how can we avoid that moving forward?
Yeah, so a couple different things there. I think that, we as Ignite, I think we're big believers in any technology that can help us do something better, has an ROI associated to it. So, back to Ray's question, is we're actually starting to see some of our hospital partners require certain technology to be part of the preferred network. We're seeing some of insurance companies require certain technology to be part of an insurance plan. We're seeing, people start to buy in, which again has continued, I think, to lift our industry up. That is saying, hey, we're going to require you guys to utilize more technology. I still think that that we need more vendors, we need more innovation, we need more people that see there's a value in this, and then we need the operators to see that they can do better with it. I mean, we can improve reimbursement rates, we can improve care, we can improve, staff satisfaction. We can do, kind of more with less because technology is helping us get there. I still think we're on the bleeding edge of it. I think there's a lot of stuff coming, but it's exciting to see, where this, type of discussion is key in an industry-wide panel. I think this kind of discussion that's a part of a lot of, webinars and other things that are going on, because I think the next couple of years are going to be very key for, I think, separation of the who's who in terms of operators is going to come through who's adopting technology. Anything else to add?
I think you hit it, Tim.
Yeah.
Yeah, I think so too.
Any other questions? All right, we saved us with perfect timing almost. All right, guys, thank you very much. Thank you to the esteemed panel. Thank you.
Thank you.